We have new information for you about the Legionella outbreak at UAB Women and Infants Center in Birmingham. State health officers say the risk appears to be contained, and now the focus has shifted to the response. WIAT 42 News reporter Mike McClanahan joins us live with more on whether the hospital waited too long to report the outbreak based on the state guidelines. Mike?
Sherry, there are rules that govern healthcare providers, and one of them is to report outbreaks of any kind to the state health department within 24 hours of diagnosis. Well, we contacted UAB and the state health department to find out why that didn't happen. This is what we heard. Here's what we learned from Dr. Loring Rue, a surgeon who spoke about the outbreak at the Women and Infant Center.
I can tell you that the cases were identified in early May. That led us to detect that we had an issue with Legionella in the medical center.
Healthcare providers are required to report outbreaks of any kind within 24 hours to the Alabama Department of Public Health. Wednesday, the state epidemiologist told us they were notified May 19th.
I have to be candid, we were focused on trying to deal with the problem.
Doctors are also required to report any cases of legionellosis to the state health department within 7 days of diagnosis. Today, the state health officer tells us UAB did send lab results in a timely manner from April 11th to May 19th. And even though UAB was late reporting the outbreak, Dr. Don Williamson says they did the right thing.
While they didn't report those clinical information exactly as the rules would have required, they did something more important, and that is they took the steps to prevent transmission. And again, based upon what we've been able to piece together, we can't see anything that they could have done to have prevented any of the cases or deaths that occurred.
There are still 9 confirmed cases of Legionella infection among people who are or were in the hematology oncology unit between the 5th, 6th, and 7th floor. Now, they don't know whether the visitor, who is the 9th case, contracted that infection at UAB or somewhere else.
Mike, does UAB face any penalties for the violations or for how they reported the Legionnaires' discovery?
Well, the chief health officer for the state, Dr. Williamson, says non-reporting carries a misdemeanor penalty, but it doesn't sound as if the state has any interest in punitive action against UAB. Dr. Williamson says the only thing that would have been different likely in this case is that the CDC would have gotten involved a little bit sooner. Reporting live in Birmingham, Mike McClanahan, WIAT 42 News, coverage you can count on.